All right, Maria, the San Diego County Board of Supervisors today debating how to spend $66 million saved in an evergreen fund left over from COVID. Those funds originated from the federally funded American Rescue Plan Act and must be allocated by the end of the year. Fox 5's Misha DeBono live for us downtown with that discussion. Misha.
Yeah, hi, Andrew. It was very lively. Nurses, behavioral health care workers, formerly homeless people, all asking the board to allocate these funds towards things like recuperative beds, more recuperative beds for people who are unhoused, resources, training for healthcare workers who work with those who are unhoused. At the end of the day, they decided that they need more information and they were asked to go back to the drawing board.
I've seen how the lack of adequate support and resources can push individuals into further crisis.
Passionate arguments during the San Diego County Board of Supervisors meeting Tuesday, where the board is deciding how to spend roughly $66 million put aside in an evergreen fund left over from the federal allocations during the pandemic through the American Rescue Plan Act. The board is proposing to make long-term investments in issues dealing with homeless health care.
We're looking at mostly investing in beds, like I said, recuperative care beds, and modeled on a program that's already really working very well.
And here's the best part. The federal government will match funds if the programs meet certain criteria, but it has to be allocated by the end of the year.
We'd be able to get federal reimbursement up to probably more than $35 million over 5 years, and it would be more in the long term to pay for the ongoing operation and maintenance.
Of the more than 200 people who either spoke in person, called in, or emailed, overwhelmingly in favor of adding more recuperative care beds for the homeless, who otherwise are forced out of a hospital bed and end up with nowhere to go but back on the streets, where they deteriorate further. And the allocation of funds for behavioral health care workers, which is on track to be about 18,000 shy of what's needed in our region.
We need to invest the funds to create safe places for unhoused people being discharged from hospitals to make sure that they get medical help and get on with their recovery journey. Recuperative care is one solution. These facilities provide medical staffing and support. It also frees up space in the hospitals.
It can be dangerous and cause burnout with even the most trained staff. Being short-staffed causes stress. Some nurses will be taking care of 32 patients by themselves. This is a dangerous practice for our residents and our nurses.
So this was just one of many items they talked about today, and really an exhaustive meeting, a very interesting and a very important meeting as they set the tone, first meeting of 2024. As I say, they have asked staff to go back, come up with more ideas of how to allocate this money, and they will meet again at their next meeting January 27th. From downtown, Misha DeBono, Fox 5 News.
Misha, thank you for the latest on that story.